CHED Accreditation Directives for BSN. These reports provide a comprehensive overview of the Commission on Higher Education directives for the accreditation of Bachelor of Science in Nursing programs in the Philippines. It covers the historical background, key memoranda, step-by-step accreditation process, and essential details for ensuring a high-quality nursing. History. CHED was established in 1994 to oversee and regulate higher education in the Philippines. Its mission is to ensure quality and relevance in education, and accreditation is a key tool for achieving this goal. The accreditation process for BSN program has evolved over time, with CHED issuing various memoranda to address changing needs and trends in the nursing profession. Here is a list of important CHED memorandum orders related to BSN accreditation from the beginning to the latest updates. CMO number 5, series of 2008. This memorandum outlines recent changes to the BSN curriculum, emphasizing a more holistic approach to nursing education that incorporates the latest advancement in healthcare and technology. CMO number 14, series of 2009. This memorandum provides a comprehensive framework for BSM programs outlining core values, key areas of responsibility, and competency standards for nursing graduates. It emphasizes the importance of a strong liberal arts foundation, a four-year program structure, and a focused clinical practicum. CMO number 18, series of 2011. This memorandum focuses on amendments to the sanction for non-compliance with CHED standards, particularly regarding the phasing out of nursing programs with low passing rates in the Philippine Nurse Licensure Examination. CMO number 15, series of 2017. This memorandum provides a comprehensive framework for the accreditation process, including eligibility criteria, program specification, accreditation levels, and monitoring and evaluation guidelines. Step-by-step accreditation process. Here is a breakdown of the steps involved in the CHED accreditation process for BSM programs. Initial assessment and application. Eligibility. Ensure your institution meets CHED's eligibility criteria. Legal status. Be a duly recognized higher education institution in the Philippines. Program offerings. Offer at least 6 baccalaureate programs, preferably in a university-based setting. Liberal arts education. Have a strong liberal arts education foundation, offering courses like AB Psychology, BS Biology, AB English, and so on. Gather documents. Prepare the following documents for submission. CHED. Form 1. Application for authority to operate for BSN program. Program proposal. A detailed document outlining your program's objectives, curriculum, faculty qualification, facilities, and clinical experiences. Institutional profile. A comprehensive overview of your institution, history, mission, vision, governance, and resources. Faculty qualification. Documentation of faculty members' educational background, professional licenses, and teaching experiences. Facilities and resources. Evidences of adequate facilities, equipment, and learning resources for the BSN program. Clinical affiliation agreements. Contracts with the hospital and other healthcare facilities for clinical practicum placements. Financial capacity. Demonstrated financial resources to support the program's operation and sustainability. Submit application Submit your completed application package to the CHED Regional Office responsible for your institution location. Here's our CHED evaluation and assessment. Initial review. CHED will conduct an initial review of your application documents to assess completeness and compliance with requirements. On-site visit. If your application meets initial requirements, CHED will schedule an on-site visit to your institution. Program assessment. CHED evaluators will assess your program based on curriculum alignment with CHED's CMO number 14 series of 2009 and its amendments as well as the specific guidelines outlined in CMO series of 2017. Faculty, qualifications, experience, and commitment to teaching and research. Facilities, availability of adequate classrooms, laboratories, libraries, and clinical facilities. Clinical experiences, quality and variety of clinical placement, supervision, and student learning opportunities. Program outcomes, evidence of student learning and achieving of programs objectives, quality management system, institutional mechanism of continuous improvement, and quality assurance. Here's our CHED decision and accreditation. Accreditation status. Based on the evaluation process, CHED will decide on the accreditation status of your BSN program. Full accreditation, awarded for a period of 5 years, indicating that your program meets all CHED standards. Provisional accreditation, granted for a period of 2 years, indicating that your program needs to address specific areas for improvement. Denial of accreditation. If your program fails to meet CHED standards, accreditation will be denied. Accreditation certificate. If your program is accredited, CHED is issue an accreditation certificate recognizing your program's quality and allowing your graduates to sit in the Philippine Nurse Licensure Examination. Ongoing monitoring and evaluation. Periodic reviews. CHED will conduct periodic reviews of your program to ensure continued compliance with accreditation standards. Reporting requirements. Your institution will need to submit regular reports to CHED, including data on student, enrollment, faculty qualification, and placements and program outcomes. Renewal of accreditation. To maintain accreditation, your program will need to undergo a renewal process every 5 years, demonstrating continued compliance with CHED standards. The foundation. CHED's mandate and the importance of accreditation. CHED is a government agency tasked with overseeing higher education in the Philippines. Its primary objective is to ensure that all educational institutions provide quality education that meets national and international standards. This includes setting standards for accreditation, which is a process of evaluating and recognizing the quality of program or institution. Accreditation is vital for nursing programs for several reasons. Ensuring quality. Accreditation ensures that nursing programs meet specific standards for curriculum, faculty qualifications, facilities, and clinical experiences. Public trust. Accredited programs are recognized as meeting high standards, building public trust in the quality of nursing education. Professional recognition. Accreditation is often a requirement for nurse practice in the Philippines and internationally. Global competitiveness. Accreditation helps ensure that Filipino nurses are equipped with the necessary skills and knowledge to compete in the healthcare market. Program objectives and core values. Program objectives and core values. CMO number 14, series of 2009, emphasizes the importance of caring as the care of nursing. It outlines the key areas of responsibility for which a nurse should demonstrate competence, such as safe and quality nursing care. This involves providing competent evidence-based care that prioritizes patient safety and well-being. It involves adhering to established protocols, utilizing best practices, and continuous evaluating care process to minimize risk and improve outcomes. Management of resources and environment. Nurses are responsible efficiently utilizing available resources like equipment, supplies, and personal protective provide optimal patient care. This includes managing the physical environment and ensuring cleanliness and promoting a safe and comfortable atmosphere for the patient and staff. Health education. Nurses play a vital role in educating patients and their about condition treatment options and self-management strategies. Effective health education empowers individuals to make informed decisions to their health and promotes disease prevention and wellness. Legal responsibility. Nurses are bound by legal and ethical obligations to practice within the scope of their license and adhere to relevant laws and regulations. This involves understanding patient rights, maintaining confidentiality, and documenting care accurately. Ethico-moral responsibility. Nursing practice is guided by a strong ethical framework and emphasizes compassion, integrity, and patient advocacy. Nurses are expected to act with honesty, respect, and a commitment to upholding professional standards. Personal and professional development. Nurses are lifelong learners who continuously strive to expand their knowledge and skills. This involves pursuing advanced education, attending conferences, and engaging in professional development activities to stay current with best practices and advancement in the field. Quality improvement. Nurses are actively involved in identifying areas for improvement within the healthcare system and implementing strategies to enhance patient care. This includes practicing in quality improvement initiatives, analyzing data, and implementing evidence-based solutions. Research. Nursing research play a crucial role in advancing the profession by generating new knowledge and evidence-based practices. Nurses participate in research studies, analyze data, and can contribute to the development of innovative interventions and therapies. Record management. Accurate and complete record keeping is essential for providing continuity of care and ensuring legal compliance. Nurses are responsible for documenting patient assessment, intervention, and outcomes in a clear and concise manner. Communication. Effective communication is a fundamental to safe and effective patient care. Nurses communicate with patients, family, other healthcare professionals, and administrators to ensure clear understanding, coordinate care, and address concern. Collaboration and teamwork. Nursing practice often involves working collaboratively with other healthcare professionals to provide comprehensive patient care. This requires effective communication, mutual respect, and a commitment to share goals. Authority to operate. CMO number 14, series of 2009 stipulates that all private higher education institutions seeking to offer the BSN program must secure proper authority from CHED. State universities and colleges and local colleges and universities must also comply with the provision of CMO. Policies and standards for BSN program. CMO number 14, series of 2009 and CMO number 15, series of 2017 outline the specific policies, and standards that all BSN programs must adhere to this curriculum. The curriculum must include general education and professional courses. Professional courses should start in the first year and continue through the fourth year. The curriculum should be aligned with the latest advancement in healthcare and technology. Faculty qualification. CHED requires faculty members to hold a master's degree in nursing or a related field with relevant clinical experience and teaching expertise. Facilities. The institution must have adequate classroom, laboratories, libraries, and clinical facilities to support the BSN program. Clinical experiences. The program must provide an intensive nursing practicum to refine clinical skills. This involves clinical placement in various healthcare settings, ensuring adequate supervision and learning opportunities for students. Competency standards. The CMO outlines core competency standards and indicators for each key area of responsibility. This standard emphasizes the development of analytical and critical thinking skills in nursing practice. Specifications. Degree name. The degree name must be Bachelor of Science in Nursing. Program duration. The BSN program must be at least 4 years in duration. Competency standards. The CMO emphasizes the development of analytical and critical thinking skills in nursing practice. It outlines core competency standards and indicators for each key area of responsibility, such as safe and quality nursing care, management of resource, health education, legal responsibility, and ethical moral responsibility. Amendments and updates. Since the initial release of CMO number 14 series of 2009, CHED has issued several amendments and updates to addressing involving needs and trends in the nursing profession. Notably, CMO number 18 series of 2011 introduced stricter sanctions for non-compliant programs and focus on strengthening the monitoring and evaluation process. Latest developments. Recent development in CHED accreditation for BSN program include new nursing curriculum with exit credentials. CHED has formulated a new nursing curriculum that includes exit credentials, allowing nursing students to work even after completing only a year of their studies. This initiative aims to address the shortage of nurses in the Philippines by providing a pathways of the students to enter the workforce earlier. Initial assessment and application. These steps involves eligibility. Ensure your institution meets CHED's eligibility criteria. And then gather documents. Prepare the required documents for submission. Submit application. Submit your completed application package to the CHED regional office responsible for your institution location. CHED evaluation and assessment. This step involves initial review. CHED will conduct an initial review of your application documents to assess completeness and compliance with requirements. On-site visit. If your application meets initial requirements, CHED will schedule an on-site visit to your institution. Program assessment. CHED evaluators will assess your program based on the criteria outlined. CHED guidelines. CHED provides comprehensive guidelines for BSN accreditation, including CMO number 14 series of 2009. This memorandum order outlines the policies and standard for BSN programs in the Philippines. It covers curriculum, faculty qualification, facilities, clinical experiences, and competency standards. CMO number 15, series of 2017. This memorandum provides a comprehensive framework for the accreditation process. CHED decision and accreditation. Based on the evaluation process, CHED will decide on the accreditation status of your BSN program. Full accreditation, awarded for a period of 5 years indicating that your program meets all CHED standards. Provisional accreditation, granted for a period of 2 years indicating that your program needs to address specific areas for improvement. Denial of accreditation. If your program fails to meet CHED standards, accreditation will be denied. Accreditation certificate. If your program is accredited, CHED will issue an accreditation certificate recognizing your program have a quality and allowing your graduates to sit in the Philippine Nurse Licensure Examination. Outgoing monitoring and evaluation. CHED conducts periodic reviews of accredited programs to ensure continued compliance with accreditation standards. Institutions must submit regular reports to CHED, including data on student, enrollment, faculty qualifications, clinical placement, and program outcomes. Programs must also undergo a renewal process every 5 years to maintain accreditation. CMO number 14, series of 2009, elaborative details curriculum. The curriculum must include general education and professional courses. The professional courses should start in the first year and continue through the fourth year. The curriculum should be aligned with the latest advancement in healthcare and technology. Faculty qualifications. Faculty members must have hold a master's degree in nursing or related field. They must have relevant clinical experience and teaching expertise. Facilities. The institution must have adequate classroom, laboratories, libraries, and clinical facilities to support BSN program. Clinical experiences. The program must provide an intensive nursing practicum to refine clinical skills. This involves clinical placement in various healthcare settings, including adequate supervision and learning opportunities for students. Competency standards. The CMO emphasizes the development of analytical and critical thinking skills in nursing practice. It outlines core competency standards and indicators for each key area of responsibility, such as safe and quality nursing care, management of resources, health education, legal responsibility, and ethical moral responsibility. CMO number 15, series of 2017, this memorandum provides a comprehensive framework for the accreditation process. Eligibility criteria. The memorandum outlines the specific requirements for institutions seeking to offer BSN programs, including legal status, program offerings, and faculty qualifications. Program specifications. It details the specific requirements for the BSN curriculum, including the duration of the program, the required courses, and the clinical practicum. Accreditation process. It outlines the steps involved in the accreditation process, including the application process, the evaluation process, and the decision-making process. Accreditation levels. It defines the different levels of accreditation for BSN programs, including Level 1, Level 2, Level 3 accreditation. Monitoring and evaluation. It emphasizes the importance of ongoing monitoring and evaluation of BSN programs to ensure compliance with accreditation standards. Competency standards. The CMO emphasizes the development of analytical and critical thinking skills in nursing practice. It outlines core competency standards and indicators for each key area of responsibility, such as safe and quality nursing care, management of resource, health education, legal responsibility, and ethical moral responsibility. Nursing practicum. The BSN program must provide an intensive nursing practicum to refine clinical skills from the first year level to ensure basic clinical competencies required of a beginning nursing practitioner. The practicum should be conducted in a various healthcare settings under the supervision of qualified nurses. Clinical affiliation agreements. Your institution must have agreements with hospitals and other healthcare facilities for a clinical placement. These agreements should ensure adequate supervision and learning opportunities for students. Faculty qualifications. CHED requires faculty members to hold a master's degree in nursing or a related field. They must have relevant clinical education and teaching expertise. Facilities and resources. Your institution must have adequate classroom, laboratories, libraries, and clinical facilities to support the BSN program. These facilities should be well-maintained and equipped with the necessary resources for student learning. CHED guidelines. Carefully review CHED's policies and standards for BSN programs, including CMO number 14, series of 2009, and CMO number 15, series of 2017 before starting the accreditation process. Program planning. Develop a comprehensive and well-designed BSN program that meets CHED requirements and prepares graduates to the nursing profession. Faculty development. Invest in faculty development programs to ensure that your faculty members have the necessary qualification and skills to teach the BSN curriculum. Clinical partnership. Establish strong clinical partnership with reputable hospital and healthcare facilities. Here are our references, the CHED Memorandum Order, and thank you. Thank you po.